Hi, guys. Every week I receive lots of questions via email or through social media, and they're surrounding total knee replacement, arthritis, and the recovery period after total knee replacement. So, today I want to address the two most frequently received questions. And those questions are: what is the pain like after surgery? And will you have outpatient physical therapy? Let's be honest. I'm just going to be real with you. The pain after a total knee replacement surgery can be severe. The first few weeks, it is quite severe, and it can be trying at times. However, the pain that you have after total knee replacement surgery is temporary. It gets better each week, and it allows you the opportunity to have a better life. I like to encourage people to look at it in this regards. Prior to having surgery, you had arthritis pain probably every day in some form or another, and that may have been for the last few years. You endured lots and lots of pain for a very, very long time. After surgery, you're going to experience pain, and it's going to be severe at times, but it's of a much shorter duration. And the biggest thing from having total knee replacement surgery is you no longer have the pain of daily arthritis pain. So you have to make a decision for you that's based on your life and what's best for you. Do you want to endure this temporary pain so that you can have a better life? Or would you rather continue to suffer every day? Because that's what's happening when you have arthritis every day, you're suffering. And it affects everything about your life, your mobility, the, your ability to do simple tasks around your home, house cleaning, grocery shopping, and taking care of children or grandchildren or your pets. Arthritis affects every aspect of your life. But the fear of the severe pain after surgery often stops people from having the surgery. I'm not gonna, ice it over. It's a tough recovery. It requires a lot of hard work, and it requires some dedication to yourself, dedication to your physical therapy, and dedication to the life and the goals that you have afterwards. So, yes, there is pain after surgery, but think of it in the regards of what you get as a result of that pain, and that pain is temporary. The arthritis pain you're experiencing now is a daily occurrence, probably, and will get worse with time. And the other aspect that is often overlooked when you have an arthritis in your right knee, for example, and it is a long ongoing, and you've had it for years and years. Well, we as humans, we naturally compensate for pain by using our other parts to put less stress on that painful right knee. Well, in the process, you're putting more stress on your left knee. You're putting more stress on your hips. You're putting more stress on your lower back and your shoulders. So when you wait 10 years to have this surgery, well, you get the surgery and find out you're still in pain because you've hurt all of these other parts in the meantime, trying to compensate for that one injured part. So there are lots of things to take into consideration before you have surgery. And I encourage you to explore all your options. Don't take it lightly. This is your life, and I want you to make choices and decisions that allow you to live your best life. Is knee replacement surgery right for you at this time? Maybe, but maybe not. But that's a choice for you to make. So, in regards to the pain, yes, it is painful. I won't lie, it is painful. But based on your goals and your current situation, I want to put you in a position to make the best decision for you that allows you to have a fulfilling and joyful life. So, um, think of the pain as temporary. Also, think of what you get in return, and think about how you're suffering every day now, and then make a decision that fits your life. And then in regards to the physical therapy, yes, there's physical therapy after total knee replacement. There's lots and lots of physical therapy. The physical therapy starts in the hospital. Typically on the day that you have surgery, a physical therapist will come, help get you up on the side of the bed, and depending on how you feel, you may stand up or you may actually take a short walk. It just depends because every patient is different. Every surgery is different. I had a totally different experience with physical therapy after my right knee replacement versus my left knee replacement. Still the same process, but a different progression based on uh, how long my surgery was, how damaged the joint was before surgery. All of that plays a part in what you do the first day. So after your initial physical therapy session, you will continue to have physical therapy in the hospital, probably twice a day while you're hospitalized. And then once you return home, you are typically given in-home physical therapy for 2 to 3 weeks. Now, again, that's based on every patient. It may be a shorter time period. It may be a longer time period. Everybody heals differently. Everybody feels pain differently. And everybody progresses at a different rate. So one of the things I want to mention in regards to that is don't hold yourself up in comparison to what other people do, because there are videos on YouTube of people walking right after surgery with no cane and no walker, and that's great. I'm really happy for them. However, that's not the typical patient story. I used a walker for 2 to 3 weeks after both of my surgeries. Then I progressed to the cane. Then I progressed to walking on my own. And after having in-home physical therapy for 2 to 3 weeks, I then progressed to outpatient physical therapy, where I went to the center to get my physical therapy. I chose a center that had aquatic physical therapy because I love water activities and it's easier, quite frankly. And I knew my right leg was really damaged, so I wanted something that was going to help me get stronger, but that wouldn't cause so much pain and swelling afterwards. So I opted for aquatic physical therapy. You'll have different options available to you depending on what area you're in, but most likely you will have some type of physical therapy afterwards. And I want to encourage you to put your all into your physical therapy, because this is your life, and the amount of work you put in now has a direct impact on the abilities and how your prosthesis works afterwards. So if you don't put all your effort into your physical therapy, you're not going to have that greater outcomes, and that's just being honest. Half do the PT, uh, and the results will show. And let me warn you guys, no matter what you say, your physical therapist and your surgeon, they know whether or not you've been doing your physical therapy. So you cannot go in and say, I'm doing it 4 times a day, every day, just like you instructed, and I'm not gaining any degrees. They know better. And everybody else who's had the surgery know better too. So I want to encourage you to put your best effort into your physical therapy. And it's going to look different from day to day. Well, if you start therapy out in pain or with some swelling, it may be difficult. But again, what you get afterwards is worth the effort that you're going to put into it now. So, in regards to pain and physical therapy, yes, you're going to have pain. Yes, you're going to have physical therapy. But the reward that you get afterwards is so worth it. So, take a deep breath and don't allow the fear and the anxiety that you're experiencing now keep you from making a decision that's going to allow you to live a healthier, happier life, more fulfilling and more satisfying life. Life is yours to have if you want it. So make choices today that empower, uplift, and motivate you to go after the things that you want in life. And so that's all I have to say today, guys. Also, if you click the link below, you can go to the link to get my book. I had knee replacement. Now what to expect after total knee replacement. It goes into a little bit more detail than what I've gone into here today. And because I'm a life coach, it also includes exercises that just ask questions that make you think about what it is that you really want. Why are you doing this? Because your goals and your intent, all of those things is what is going to help you push your way through when you feel like you can't do this anymore, because you're going to have some days. You're going to have days when you feel tired and in pain and just feel like I cannot do this. But let me assure you, you can. You have everything you need within you to reach the stars. So go into this surgery. You may choose to have the surgery, you may not. But if you choose to have the surgery, go into it knowing that you already have everything you need to be successful. You have God on your side. You have people cheering for me. You'll hear me cheering from your hospital bed, just cheering for you. And if you feel like you need some support after surgery, I also offer post and pre surgery calls to help you with the anxiety, the frustration. As somebody who has had 11 orthopedic surgeries, three of which were in 2015, I know what you've experienced afterwards can be emotionally and physically taxing. And you sometimes you need the support of someone who's been through it. And as loving and supportive as your family and friends are, sometimes they just don't get it. And it's not because they're not trying to be empathetic, but I didn't know my own body could hurt so well, so much until it actually did. So it's not that they don't love you and support you and are empathetic and sympathetic. It's just that they don't have the frame of reference to support you in a way that you need to be supported. So if you need that support, please email me. My email address is in the comments below. Reach out to me here in the comments or through my email or on other social media. I always answer it, and I do answer my own email, even though I do have some support staff. So please, I want you to have your best life. This is my purpose in life. This is my mission in life, to help other chronic pain sufferers, because I know I suffered for 33 years. And if I can prevent one person from suffering any longer than they have to, then my job has been done. Guys, thanks for watching. I hope this has been helpful. And if you have questions, just reach out to me. I'm always here for you. Thanks, guys. Bye.